Right now, an inside look at the impact of the pandemic on local healthcare workers. Throughout the past year, we've covered the rising death toll from the coronavirus. Tonight, we're looking into the mental toll on doctors and nurses fighting on the front lines. Our own Chloe Vincenti spoke with several healthcare workers and joins us now with the story.
At some point during the pandemic, all of us have probably felt some form of COVID fatigue. The CDC even has guidelines for how to cope with stress during this time, listing some of the symptoms like feeling angry, lacking motivation, and being tired. Now imagine the healthcare workers in the hospitals, caring for patients with COVID-19 and working more hours than ever before. I sat down with 2 doctors and a nurse at Guthrie who explained the fatigue on the front lines.
This is a once-in-a-century phenomenon, and we've risen to meet the challenge. This very well might be our finest hour.
Dr. John Rittenberger, Dr. Jagmeet Singh, and Nurse Michelle McKernan all share one thing in common.
It is there, and it does kill people.
Working on the front lines, these Guthrie healthcare professionals see the impacts of the coronavirus firsthand.
We in the United States have a very good healthcare system, but we were not prepared for this pandemic.
It's a battle they've fought since the virus hit New York and Pennsylvania last March.
In the beginning, we thought we might die. We didn't know that. But, somebody had to do the job. We did it.
I sat down with the 3 of them to talk about how they're still doing that job a year later.
What has it been like for you? Has it made you rethink your career choice? Has it made you exhausted? I mean, what are the emotions you guys are feeling?
Yeah, I think at times it has made me rethink my career choice. Absolutely. I lost a family member myself through this COVID pandemic. It was difficult to not be able to be there and to be expected to take care of strangers on a daily basis. And it was okay for me to be there for them, but not be able to be there for my family member was a very challenging thing for me to get over.
You feel like you're drinking from a fire hose at times.
Along with the long hours and extra shifts, the pandemic is taking a serious mental toll on doctors and nurses. According to a Mental Health America survey, 93% of healthcare workers are stressed, 86% experience anxiety, and 76% report exhaustion and burnout.
Anything happens for 1 or 2 months, you can handle it. But when it starts stretching out, there's a COVID fatigue in physicians also, which is happening.
And seeing patients lose their battles with COVID doesn't get easier.
Walking away multiple times in a row knowing that, you lost that battle, that's very challenging.
At Guthrie, doctors and nurses are offered mental health services if needed, and the support system extends far beyond that.
One of the silver lining was we all know that we all here for each other.
Rising to meet the challenge together.
The patients truly appreciate everything that we're doing for them, and that's what keeps us coming back every day.
Now, all of the healthcare workers I spoke with say they have been vaccinated, offering them a feeling of safety while at work and a hope for less COVID patients in the future.